and welcome. This is MD, board certified pediatrician and licensed in several states in the United States. I would like to emphasize that this video and all other videos in this series are for informational purposes only and are not a substitute for diagnosis and treatment by your child's doctor. Today I'm going to discuss fevers in children. One of the most worrisome things for a parent is when your child is ill and has a fever. Child doesn't feel well, starts crying, and the parent also starts crying. You can all relate, can't you? The parent is worried that something serious may be causing the fever, and many times is also worried that the fever itself may be causing harm. By the end of this video, you will have information which will enable you to assess the fever so that your concern does not escalate into panic. So let's get into it. First, what's the fever? Fever is an internal body temperature which is above the normal range for a given age. Internal body temperature, that's important, and it's above the normal range for a given age. That means for a specific age, a fever may be quite different than another age. For example, babies from birth to about 2 months of age are considered to have a fever if their temperature is over 100.4 degrees rectally. After 2 months of age, all the way to about 10 years of age, a fever is considered anything above 101.5 degrees Fahrenheit. We'll round it off to 101 degrees Fahrenheit. About 10 years of age to about 16 years of age, a fever is considered to be something above 100 degrees Fahrenheit. And from upper teenage years all the way through adulthood, a fever is considered to be a temperature that is above 98.6 degrees Fahrenheit. Where should you measure the temperature? Remember, the most accurate temperature would be an internal body temperature. Therefore, the most accurate temperatures are measured rectally in the younger child and orally in an older child. Convenience, however, plays a part. So using an axillary or underarm temperature is convenient, but that's the skin temperature and not very accurate. Using the strips on the forehead are again convenient but not accurate. Also, tympanic temperatures, which are the ear temperatures, are subject to variation depending on how straight the ear canal is and if there is wax in the ear canal. Another temperature taking device which has been important recently because it does not depend on contact and it's very quick also in terms of the temperature reading. It's a temporal artery thermometer, which is the ones you see pointed at the forehead or around to the side. It is fairly accurate, it's quick, it's convenient. The thermometer is very expensive. However, there are some limitations to the temporal artery thermometers because the environment does play a role. If the place is very hot or very cold, it may affect the temperature reading slightly. So again, the most accurate temperatures are oral or rectal. However, temporal artery thermometers are fairly accurate and very convenient. Why do we need an accurate temperature? Most pediatricians want to have an accurate temperature reading because diagnoses that are made are dependent on how high that temperature is. For example, someone will come in and say that their child has had a fever for 2 days and when you ask them what the temperature was, they would say 99 degrees Fahrenheit. From what you've learned so far, that is not a fever in a child. Someone else would come in and say, my baby has a temperature of 101.8 degrees Fahrenheit, so I think it might be from teething. Teething usually does not cause fevers above 101 degrees Fahrenheit. So in this case, we would have to look elsewhere for the reason for the fever. Most fevers which are above 104 degrees Fahrenheit may suggest that something more serious could be causing the fever. And again, we would like to know what that temperature is in an accurate manner. How do you treat a fever? Medications used are either acetaminophen, which is brand name Tylenol, or ibuprofen products. There are two brands that we normally use with ibuprofen, which is Motrin and Advil. Tylenol is safer at the recommended dosages. Ibuprofen has more side effects. Tylenol may not work as well as ibuprofen in some circumstances. Tylenol needs to be dosed every 4 hours. Ibuprofen is every 6 to 8 hours. Another way to decrease the fever, especially if the medication is not working, is to sponge bathe or put the baby or child into a bathtub with room temperature or tepid water, not cold or water or ice. Remember, the most important thing in treating a fever is the comfort of the child. The temperature is felt to be the body's defense mechanism to kill certain organisms which cannot survive at higher temperatures. We treat fevers to make the child comfortable. And again, you do not have to get that temperature all the way down to normal when you treat it. What is most important is that the child is comfortable. What causes a fever? Fevers are a manifestation of infections or inflammation in the body. In children, most infections are caused by viruses. Viruses typically are self-limited. They tend to cause fevers for 3 to 4 days, and then the body's immune system gets rid of the virus. Bacterial infections are more serious, and they typically will cause higher fevers, but not all of the time. Viruses typically we cannot treat with medications, while bacterial infections are usually treatable with antibiotics. Another reason for a fever, which is outside of infections or inflammation, is temperature elevation being caused by an external source. For example, heat stroke or sun poisoning, where there's an external environmental problem causing your body temperature to rise. When should you worry about a fever? Fevers are again manifestations of infections, but there are some things you need to consider when a child has a fever. One of those things is how high the fever is. Fevers that are usually above 104 degrees Fahrenheit may mean that there is more of a serious problem going on. In addition, fevers that last more than about 4 days may mean that there is a bacterial infection going on instead of a viral infection. And remember, bacterial infections usually are more serious than viral infections. If a fever is increasing with every day, or as the days progress, that is more serious than if the fever starts high and is going downwards as the days progress. Younger age is important. Less than 3 years of age with a fever is important, especially less than 6 months of age. If a child who is less than 2 months of age has a fever, in many instances that infant needs to be hospitalized. Other symptoms associated with the fever may indicate that there is a problem. For example, chills, pain, lethargy when the temperature is down, vomiting, stiff neck, shortness of breath, or rash may indicate that there is somewhat of a concerning problem or a concerning cause for the fever. Now remember, children will be lethargic when the temperature is high. When the fever usually comes down, they will be more perky and more active. It is concerning if a fever comes down and they are still lethargic. What is most important is how the child is acting. If your child has a 102°F fever and is running around and is acting normally, that is less important than 101 fever and your child is very lethargic. So to recap, the important things to worry about if your child has a fever is a temperature over 104, a fever which lasts more than 4 days, a fever which is increasing as the days progress, a child who is less than 3 years of age or even younger, symptoms like chills, pain, lethargy, vomiting, stiff neck, shortness of breath, and rash are important. What is most important is how your child is acting. Are they eating as usual? Are they active? Are they playing? Or are they lethargic? Those are the important things that you need to use in order to assess whether a fever is serious or not. Can fevers cause seizures or brain damage? Fevers themselves can cause seizures in certain subsets of the population. If your child has a seizure disorder, what we used to call epilepsy, then a fever may trigger a seizure in that child. In a small subset of the population, there are some children who are between the ages of 6 months and 5 years of age who may be subject to what's called febrile seizures. Those children, when they do get a fever, they may have a seizure. Usually febrile seizures resolve after the age of 5. Not everyone with a fever will get a seizure, but only those people who are in the two categories which I mentioned. Brain damage. Is it possible from a fever? Very, very unlikely, even with fevers of 105 or 106 degrees Fahrenheit. The exception is if someone has a regulatory problem within the brain. There are certain parts of the brain that regulates temperature. And if you have a defect in that part of the brain, you may not be able to decrease your body temperature. Also, there are very rarely people who have lack of sweat glands. Those people may not be able to regulate their body temperatures. Now, brain damage can sometimes occur from external sources of heat. For example, which happens once in a while, a child is locked in a car which is very hot, and the parent forgot that they were there and they were subject to that high temperature from heat and from the sun. So in summary, fevers are important in that they alert you to an infection in your child. Be concerned, but do not panic. use some of the information which I provided to you in this videotape to assess that fever and determine if you need to be overly concerned or not. Remember, if you are unsure or have doubts, call your doctor or see them in person so that your child may be evaluated. That is all for now. Hopefully this video has been helpful. Please join me in my next video, and do not forget to touch that subscribe button so that you will be notified when the next video is uploaded. This is MZMD wishing you a healthy life.